du coup passer à une vision un peu plus globale de SNOMED parce que on a quand même la chance d'avoir le big boss de SNOMED International avec nous ce matin. Il est CEO de SNOMED, il a plus de 30 ans d'expérience dans l'industrie de la santé. Il dirige donc SNOMED, bien sûr. Il en définit la stratégie avec l'ensemble des acteurs. J'invite tout de suite sur le plateau, mais à distance, cette fois en duplex depuis le Canada, Don Sweete. Hello Don, how are you?
Good, and you?
I don't hear the Don. How are you? Fine?
I am good. I am
Ah,
good.
good. Okay. It's a problem on the stage. So, Don, I think that this year you have a fairly busy year with SNOMED. I hear when we prepare this presentation that there is a refreshed in the 5-year strategy of SNOMED. Can you give us to all the attendees some highlight on this?
Yes, I can actually. It's a good segue into my presentation. I would like to start by thanking the organizers of the conference. I think it's a wonderful conference, and I'm excited to be asked to present. I would rather be there in person in Paris, France, rather than in cold Canada, where it's still dark out. If you'd like, I can start the presentation and talk about what we're doing and give some highlights of our strategy. So let me begin by talking about our strategy. As we all know, in the current era of pandemic, data has become very, very important. In fact, it's one of our most valuable resources that are available today. Health data delivers that additional value that starts us to look towards predictive analytics of what is happening. And we have seen that play out as it relates to the COVID-19 pandemic that we're currently in. The other piece that is required in order for data analytics to become really the linchpin of how we look at healthcare moving forward is really EHR interoperability, and also the fact that the data needs to be structured. We simply cannot share, aggregate, and analyze health data if it's not captured in a structured way. It becomes too cumbersome and it cannot be leveraged for a number of new techniques that are evolving and emerging in the world today. Obviously, artificial intelligence, innovation, natural language processing, and other things. So I'll talk a little bit about the vision of SNOMED International. Our vision is really that SNOMED International really look at being a hub for other terminologies, so that all of those terminologies and vocabularies can collaborate together. They can link together, which will result in better health and better patient outcomes. And more importantly for us, it also means that it's easier for people to implement what they need to in order to move the data to get the information to the clinician, the right information to the clinician at the right time. Our 5-year strategy is unique. We worked for a year on this strategy. It is probably the most engaged strategy that we have because it was developed by our General Assembly members who represent the 39 countries that are members of SNOMED International. We receive feedback from clinicians, from vendors, from the community of practice, and certainly the staff within the organization itself. We have 3 strategic directions and 6 priorities. And one of the things that we pride ourselves on is the fact that we are an open and transparent organization. And so we measure value. So we can track our successes and our failures and be open and honest about how we're doing to our members and to the public at large. One of our strategic directions, which focuses on its products and services, really speaks to how we're changing. We're looking at evolving SNOMED CT to meet the needs of the integrated health and social care systems in a sustainable fashion. As an example of that, we're looking at adding content for social determinants of health, genomics, and also devices. You can see on the slides, which hopefully can be shared with people as well later, we have these go by an annual basis. We track our success along a 3-year basis. At the end of 2022, we will take stock and then finish the strategy over the next 2 years. The second piece under products and services goals is, as I said before, a terminology integrator. So we want to strengthen the hub that we've created. We want to be able to look at those other terminology standards and classifications to figure out how we can link with them seamlessly to help enhance and streamline the health and care ecosystem. Also, we recognize in healthcare, it's always good to be able to measure value. And so one of the things that we're looking at doing is extending the SNOMED CT value proposition to really highlight improvements in patient outcomes and determine and validate all of the stakeholder benefits. And so we have recently released a series of videos on an example of that, a case study, if you will, of what has happened in New Zealand with one regional health authority, how they had a need, they implemented SNOMED CT, and the videos certainly show how SNOMED CT has made a difference. As always, we understand that when governments are grappling with budgets, they want to get value for money. So we're currently working on a case for investment. So what happens when a country or a health system uses SNOMED CT? What are the measurable benefits that can be derived from that? And we'll be working on that in 2021. The other piece for us is around adoption. Certainly from our perspective, it's not just about people using SNOMED CT, but how can we improve the way that they use SNOMED CT? And so work is being done in that area, as well as looking at educating people on what SNOMED CT is and how it can be used. And so you can see some of the goals and objectives that we have in that area for adoption and consumption. Another area is implementation support. We're a very, very small organization, so we always try to do things that help leverage the strengths of our community of practice and our members. But one of the things that we've been tasked with is to provide sustainable and approachable products and services to help support the implementation of SNOMED CT. As some of you might know, we basically released a global patient set, which allows people all over the globe to freely use a small core set of SNOMED CT to codify the most common elements that they need for patient care. We, as part of the pandemic response, also put COVID-19 codes in there as well. We're also looking at all of our tools and looking to refine them to make them easier to use and to support the use of SNOMED CT. And maybe some of those tools can be leveraged for the use of managing other terminologies. So you can see the goals laid out there. Innovation is something that I think every organization is looking toward now. And one of the things that we have had a focus on for the last 2 years and put some funding towards is innovation within the organization, and also recognizing those people that innovate outside the organization. The key here is to develop innovative technologies and solutions that can be replicated across the globe to make it easier for people to deal with healthcare. And so we are engaged in areas of AI, other emerging tech, to look at pilots and partnerships to demonstrate success, but more importantly, if those are successes, to basically put those solutions and techniques out there for other people to use to again drive efficiencies and make things much more easier for people to use the terminologies. I want to talk a little bit about 2020. We're very, very pleased to welcome the Ministry of Health and Welfare to SNOMED International as a member, the Republic of Korea. So that brings us to 39 members, and Korea has been actively engaged since they joined this year to move forward with the implementation of SNOMED CT. I also want to talk about Germany. I think this is applicable for the audience since it's in the European Union space. In 2020, we established an agreement with the Federal Ministry of Research to basically help them with a medical informatics initiative. Their license was granted to those stakeholders to use SNOMED CT. Based on that agreement and the work that has been done throughout 2020, I'm pleased to announce that Germany will become a full member of SNOMED CT effective January 2021. For us, that is very, very exciting. We recently held a conference and an expo, and one of the countries that had the highest attendance at our conference were the multiple representatives from Germany. So we're very, very excited to welcome them to the fold effective January 1st of 2021. Also want to talk about the pandemic. It certainly affected us all, and we're now dealing with a new normal. But for us, as a virtual organization, it was business as usual, but it also allowed us to be responsive. For us, our team worked long and hard to get the COVID-19 codes into SNOMED CT and the global patient set. We also added content in genomics, social determinants of health, and we're working on concrete domains. These are needs that our members have identified to us, and clearly things that we wanted to continue to work on through these difficult times. Also, I want to thank FAST and the various organizations and countries that worked collectively to basically do the first release of SNOMED CT Common French translation. Other countries were Belgium, Canada, Switzerland, Luxembourg, and again, FAST, who have worked with us over the years to move SNOMED CT forward in France. As I said before, SNOMED CT is introduced in Germany for research, and we are certainly working with a number of other countries that are looking to become members in 2021 and in 2022. We have initially started our education, looking at developing all of the materials and doing the education ourselves online. We have now moved out to collect partners, and you can see some of the partner organizations that deliver SNOMED CT education. We will continue to push out and partner rather than do things ourselves. We also have a number of collaborations, and we continue to work with our various standards partners and vendor partners to collaborate to make SNOMED CT more readily available and more easily accessible and easy to use. And lastly, from an engagement perspective, this is something that is happening on a daily basis with us. Our teams are basically engaging virtually. We would love to get back to the ways of travel and meeting people in person, but certainly we continue to do virtual meetings, and certainly our conference in October showed that we can put on a virtual conference and engage a larger audience. In looking at the future, I think from our perspective, one of the things that's going to be required, and we're seeing it certainly in my country of Canada, is data is the new gold. And certainly as governments move quickly to virtual health, one of the things that they're going to be looking for is the ability to aggregate data that is structured, that has context, and can be easily moved between various regions to get a broader overview of what is happening with the system to allow them to make informed decisions on how healthcare should be delivered to deal with either pandemics or trends that are happening within the population within that country, and indeed a broader stake within a region of the globe or globally itself. And I think that the pandemic has done maybe one positive thing is it's hastened the need for digital health to be implemented in a more mature fashion. I'll stop there and open it up for questions. And thank you again for your patience in dealing with the technical difficulties.
Thanks a lot, Don. Thanks very much. François, you already have one question for
yes.
Don.
So first, I want to renew our apology for this technical issue that we had. Sorry to keep you in your dark night with our loop here. So I was very appealed by the vision of SNOMED City becoming a hub terminology, as you put it. What this inspires to me is that you have mapping and cooperation activities with other organizations producing health terminologies. Could you tell us a little bit more about that, or how this vision will become reality in the 5 next years?
Sure. Probably one of the areas that we have spent a lot of our time on is, and we recognize the fact that ICD is a classification that everyone needs. It's for the collection of data as it relates to public health, morbidity, and mortality. The organization has always provided maps between the two, the SNOMED CT as the terminology and ICD as the classification. For us, it's important to help organizations move that clinical information into the statistical world so that they can provide the data that is required by regional health authorities, by governments, and also to be rolled up to the global level so that there's a better understanding of what is happening with health of the population around the globe. I can give you an example, for instance, where an organization in the United States that has 40 million patients who is a mature user of SNOMED CT uses SNOMED CT and the maps to auto-generate the ICD codes, which saves them time and effort, and at the same time very easily provides them with the ability to meet the requirements of their national government to provide statistical data for reporting both within the country but also globally if required. We do have other maps and we do those in conjunction with our members or those who request those maps. I'm excited to say that one of the things that we've also been working on in the mapping world is looking at more of a, if you will, machine learning type of mapping tool, which allows us to more quickly do the maps, have them quality assured and ready for our members. And that work has been underway in 2020.
Thanks, Don.
Thank you.
We have a question from one guy from the attendees, Xavier Ganzel. And I think we take just one question, and after we let you go. Don, can we really make the hypothesis that SNOMED will be only the only health language for this making terminologies at the end in the future?
Well, the vision is that it's not SNOMED CT that will be the one health language. SNOMED CT will be part of an ecosystem. Really, if you want to think about it, SNOMED CT would be really the hub that brings all of those other terminologies together. We recognize that we can't cover all of the things in healthcare that need to be covered. And our goal is to link with other terminologies and other vocabularies to create, if you will, a seamless language of health. And SNOMED CT has the ability to link with those other terminologies and vocabularies to bring everything into the record. So we're not suggesting that we are the only thing that people will need. Clearly, in a lot of countries, there are other terminologies, very good terminologies, smaller ones that have been developed over the years that are very, very specific and granular. We would look for ways to link with those terminologies so that all of that information can be linked and everything can be put in the record. There would be a SNOMED CT, a high-level SNOMED CT hierarchy that could then link with those terminologies. So both terminologies would work together to get it into the record. So our vision really is the one language of health sees SNOMED CT at the hub, if you will, as one large terminology, but we certainly need other terminologies and vocabularies to complete that electronic health record.
Thanks a lot, Don, to be with us today. I think it's very early in the morning for you. I know that the coronavirus is growing fast in Canada. Hope you are safe and take care of you and for your family. So, sorry for the technical problems, but see you next year.
All right, thank you very much. Hopefully I'll see you in person next year.
Yeah.
Sure. Thank you, Don.
Bye-bye.
Excusez-nous encore pour cette...